Well, for Wellness Wednesday, stem cell therapy can sound like a promising alternative to surgery, especially when overseas clinics advertise lower prices and dramatic results. But before booking a trip elsewhere, like Mexico, for instance, there are important questions to ask about the treatment, your diagnosis, and the follow-up care. Dr. Ruchir Gupta with Mountain View Headache and Spine joins us now to explain what patients need to know. Great to have you here, Dr. Gupta.
Thank you for having me.
So first of all, let's start from the very beginning. Explain what stem cells are and how does it work?
So stem cells live inside our body. Basically, in our hips is bone marrow, which you extract, kind of like pulling oil out of an oil well. And then from that bone marrow, using our lab, we extract mesenchymal stem cells, which are called stem cells because they differentiate into whatever you inject them into. You put them in bone, more bone, tendon, tendon, ligament, ligament, cartilage, cartilage.
Okay.
So as long as you inject them into that tissue, it'll grow more of it.
Okay, so and now you're seeing more and more people traveling abroad, like to Mexico, for instance, to get some of this therapy. But what are your concerns?
Well, the concerns are that you get what you pay for, right? If you're being charged less, why are you being charged less? You know, we as doctors are always complaining how we're overregulated. But one of the reasons why we're overregulated is because before there were regulations in America, all kinds of crazy things were happening. When you go to Mexico, how do you know that the stem cells are yours and it wasn't contaminated with somebody else's? How do you know that it was kept in a sterile environment and you're not going to be infected?
Yeah.
How do you know that it's being administered by somebody that's trained to actually go into your body and has had the right training to inject your spine or inject your knee? So you're taking all these risks, you're saving yourself maybe a few $100s. And if all of this is happening, you have no recourse. You can't sue these people. You can't get any type of benefit from it. Nobody's going to come for your aid.
So if it causes, well, potentially more harm than good, I mean, say you get back to the States and then what?
Well, it depends on the complication. If you have an infection and you had a knee procedure, hey, infections in your knee can sometimes lead to an amputation.
Wow. Okay. So let's talk about who would make a good candidate for stem cells and who would not.
Honestly, all of the above. I've done stem cells from everyone from a high school senior to an 87-year-old.
Okay.
And it doesn't matter how old you are. Obviously, it does decrease your effectiveness as you get older, but this is not a young person's therapy. I have a lot of elderly people coming to me with this and getting great results.
Oh, that's promising. That's great. Okay, so obviously stem cell therapy, it can vary depending on maybe perhaps which clinic you go to. Every place is different. What should people understand and know and ask?
The first question is, who is the person that's going to be administering it to you? So I do spine, I do joints. I'm double board certified in anesthesia and pain medicine, so it's within my scope of practice to do that. If you're going to have somebody inject your spine, make sure that they are board certified in pain medicine or spine in order to offer you that safety. So that's the first question. What are the credentials of the person injecting it? It shouldn't be a nurse practitioner, it shouldn't be a chiropractor. It should be a physician that's been trained to do these injections by an accredited program. Second question, what are you using? Are you using stem cells that were bought? Because if it's bought, it probably isn't living.
Right.
It should come from your own body.
Your own
These
body.
stem cells don't live outside your body for more than 24 hours. So that's the second question. Third, always ask to speak to patients that have had it done.
Oh, referrals. Yeah,
Exactly.
that's huge.
And I think that that's very important.
Yeah.
So I think that those are the types of questions that you want to ask. Those are the ways that you can protect yourself from the copycats.
Yeah, those are great basic questions out of the gate. I'm wondering, how long should we expect the results to last, though?
That's a great question. And I always tell someone that, well, depends on the life that you're going to live.
Okay.
If, let's say, you're an avid hiker, you go to Zion National Park, you climb rocks, and you're a rock climber, and you're getting your knee done, well, your procedure will last for the rest of your life if you sit down on a couch and never move it. But if you intend on rock climbing still, then maybe it'll last for 10 years. It depends on how much wear and tear. But here's the point, and this is the one thing that I tell every patient.
Yes.
Nobody ever died of knee pain or even back pain. People die of a weak cardiovascular system, which they cannot exercise because they're in knee pain or back pain. So I don't want you sitting and saying, hey, I got this done, I'm never going to walk again, I don't want to have my knee get banged up.
Right.
I want you to walk again, I want you to hike again, I want you to run, do everything that makes your life worth living because you're protecting your cardiovascular system. That's going to increase your longevity, keep disease away and give you the quality of life that you deserve.
Oh, that is great advice. Any other advice that you would give to others who are considering this?
I would say shop around, talk to everybody, do your research, but know that stem cells is not a magic wand that's going to solve all your problems. The data is really strong for musculoskeletal conditions. It can't regrow your heart. It can't regrow your lung. Right now, focus on musculoskeletal conditions.
Okay, excellent advice, Dr. Gupta. Thank you so much. We appreciate it.
Thank you for having me.
Chris